This morning on BRN, reading hearing test results. We're going to welcome back to the program Dr. Julie Norin of Towson University. Dr. Norin, great to see you. Thanks for joining us this morning.
Yeah, thanks for having me. It's always a pleasure to be here.
The pleasure is mine, and Happy New Year to you as well. What I thought we would do, if you don't mind, I'm going to waive my HIPAA rights for the broader audience for the purposes of education. As you know, I went to get a hearing test in late January 21st to be exact. And first of all, Julie, it was the easiest thing. I'm going to get your reaction to this, but it was the easiest thing you could ever do. They put some stuff in your ears to listen, and then they test sounds. It was pretty easy, Julie.
Yeah, it's meant to be that way. I think over time, most people can remember being in grade school and having a school nurse or a teacher or someone else test their hearing. And it's pretty similar to that. We do a few more comprehensive things in terms of assessing speech understanding and checking the whole auditory system. But yeah, it's relatively simple. Listen for the beeps, no matter how soft they get, raise your hand or push a button. And yeah.
That's what I did. I had to push a button and they had beeps going. And I said to the doctor, I forget the doctor's name, Dr. Gosu, I think his name was. I said, what if I get it wrong? Because, when you go to the ophthalmologist or the optometrist and you're always right about, I was afraid I would get it wrong. But he told me you all have different ways of testing so that I can't get it wrong. Like you multiple test different sound ranges differently.
We do, and truthfully, there's no getting it wrong. The whole purpose of that hearing test is to determine what's the softest level that you're able to just barely hear a sound that's presented. So yeah, we do have ways of using our equipment on our side of the booth to make those sounds softer and louder. And then what we're trying to do is really narrow down where are you actually identifying all of the different frequencies that are presented. So it's actually okay if you miss a sound and you don't get it. It doesn't mean that you got it wrong. It's just helping us really narrow down where's that softest level that you're able to hear the sounds.
Now, Julie, I'll just say this. Before going into to the doctor, the audiologist, I actually had bought the new Apple AirPods 2.
Okay.
And you and I talked about this, I think, last time you were on the program. And it does a hearing test. And so I did it. I didn't buy just to be clear, I didn't buy the Apple AirPods to do the hearing test or for hearing purposes. I wanted to listen to the Grateful Dead on my phone. But it did that. And it gave me some results. It said my hearing was good. What's your reaction to that? It's not a replacement. It's supplemental to what you all do.
Exactly. Yeah. And I would use the word hearing test very loosely because it's really just a measure, and it's a very cursory measure of your hearing. And just to elaborate a little bit, you're putting AirPods in your ears, your AirPods are connected to your phone, and then you're using the phone is walking you through measuring your hearing levels by presenting sound through your AirPods. Not as perfect and comprehensive as a full assessment that's done by an audiologist in a clinic, but it's a very cursory measure of what are you hearing with the AirPods in place.
Okay, so all that being said, I went and I shared my audiogram. I think it's called an audiogram with you. I wanted to get your reaction. And I had a test, and I haven't had a test done for like 6 or 7 years. So the doctor actually requested that from my practitioner in New York. I don't think he ever got it, so I don't have any information to give you. But what's your reaction to what you saw? Because you're the expert. I'm not. I just know how to hear. So what was your reaction to it?
Yeah. First, I think it's great that you went and got the test done. And yeah, it's always good to have that baseline. And then as we get older, our hearing should be one of those things that we're measuring on a regular basis, at least once a year. If not, if you don't have a hearing loss, maybe it doesn't have to be once a year. It could be every 2 years or every 3 years. But certainly as soon as you start to experience hearing difficulty, or if someone identifies a hearing loss, then we would want to measure once a year. In terms of your results, I would say it doesn't, it's not anything that's alarming. You do have a little bit of a difference between the ears, so I would be curious to know if the audiologist you met with referred you to an ENT for maybe a medical assessment, just to make sure that there's not anything medical that could be going on to cause the difference between the ears. But yeah, I mean, I don't see anything that's alarming. And my guess would be if you feel like you're having difficulty in certain situations, maybe hearing aids would be helpful. But I would imagine in a quiet situation where it's just one-on-one, you probably don't feel like you're having all that much difficulty.
So Julie, or excuse me, Dr. Norin, is the difference, is the hearing loss enough to warrant the hearing aid? And let's start there. Is it enough right now to say, hey, Jeff, you should think, because I haven't noticed any difficulty hearing at all. I ignore my wife regularly, but she does as well to me, and her hearing, I think, is fine. So, but in all seriousness, do these results warrant me going and saying, hey, maybe I should think about getting a hearing aid?
I think that's probably the number one question that most people have is, they get their hearing tested, they end up with results that are fairly similar to yours. And I'll give a brief summary of your results. You have normal hearing in the low to mid frequencies, which are low to mid pitches. But then when you get into that mid to high pitch range, you have a mild hearing loss in the left ear, and then you have a moderate hearing loss in the right ear. So does it necessarily affect you all of the time? Probably not. I would say it's probably when you get into situations where there's a lot of background noise, or if someone is maybe not directly facing you and they have a higher pitched voice, you might feel like you don't necessarily make out everything that they say to you, but maybe you're using context to piece things together. Does that sound accurate?
Yeah, I mean, I think it's been I don't really hang out at bars anymore. Married guy, but I would say maybe sometimes it's hard to hear. And Dr. Norton, they did actually test me. One of the tests they did was being able to understand a sentence in a crowded room. They simulated that. I thought that was really interesting, and I think I got most of that right. But I think maybe in some ways I wasn't, depending on the pitch of the. Maybe if it was a woman with a higher pitched voice, maybe a little bit more difficult to hear.
Yeah, and we do that testing to determine at what point would you really benefit from features in a hearing aid, like having a directional microphone or having more or less noise suppression. You did fairly well. I mean, when speech was made louder than you needed it based on your hearing thresholds or the softest level that you're hearing, you did well. And I would say you probably aren't experiencing that much difficulty, but I have had patients come in that have had similar hearing losses that felt like, well, I could probably benefit in some settings. And they do get the hearing aids, and they find that maybe they don't use them in every single environment, maybe just the more challenging environments. The tricky thing with a hearing loss is, and specifically with your hearing loss, is you do have some frequencies where you're struggling to hear because of where the more significant hearing loss is. And the longer you go without using hearing aids, those frequencies in your auditory system just aren't getting that input. They're not getting stimulated where they should. And over time, that can lead to a cognitive decline. So a decline of the auditory system, just not being able to understand, recognize, and process what you're hearing. So I would say it's really important, given your hearing loss, to monitor your hearing over time. Then if you do start to feel like you're experiencing difficulty, you'd want to address it. You don't want to let it go.
So annually, is that about right? Yeah. Annually go for the same test. I mean, it was moderately priced, I think. So he also cleaned my ears. I don't know if that's typical, but he washed them out. I want to be
your ears before the test or after the test?
No, before the test.
Oh, okay. Good.
He flushed them, And I want to be very clear. I have pretty decent hygiene, so I do clean my ears on a regular basis. But I feel like I'm giving TMI here, but I do have some wax buildup in my left ear more than my right ear. So he cleared all that out. But going on an annual basis seems to be the right approach for now. And then see if there's a change.
Yes. And I will say, given looking at your test results, it does not look like they measured bone conduction. It only looks like they measured air conduction. And so by measuring bone conduction, what we're doing is essentially just checking the inner ear, bypassing the outer ear, the ear canal, the middle ear, which is your eardrum, and just measuring that inner ear through vibration, and then determining, is there a difference when we measure through the earphones versus when we're vibrating that inner ear directly. If we don't see a difference, then we know that the nature of hearing loss is a more permanent sensory neural hearing loss. If we do see a difference, then we know that maybe there's something medical going on that needs attention. So,
Why you
so
asked
not
me.
seeing that on your test results, it's hard to know what type of hearing loss you have and whether or not the next steps should involve consulting an ear, nose, and throat specialist to see if maybe there's something going on.
And in terms of what not to do, let's talk about like in the next year. What should obviously staying away from heavy machinery. I don't really, I have a camera and a mouse, but I mean, what are some things that I should think about not doing to keep what I got?
You don't necessarily need to stay away from those things, but certainly if you are going to be exposed to loud noise, you'd want to protect your hearing. So personally, I like going to concerts. So when I go to concerts tend to be very loud. I have musician earplugs that I'll wear to protect my hearing. Sometimes I'll wear those when I go to Ravens games too, just because the Ravens games can get loud. So I do my best to, knowing whenever I'm going to be in a loud environment, to use earplugs. I also recommend, for people who might be weekend warrior types where you do stuff around the house, there are a lot of people that might use, snowblower this time of year, or a lawnmower in the spring and summer, or power tools, leaf blowers, things like that. Even hair dryers. People don't recognize that there are things in our environment that we're doing regularly or semi-regularly that could impact our hearing and lead to a decline in hearing. So using things like earmuffs or hearing protection, even just foam earplugs, making sure that they're inserted properly to protect your hearing from further decline.
Yeah, really important. Well, Dr. Norin, I can't thank you enough. I think this is an example. It was painless. I think it's good information. I'll be 53 in May. I was interested in my health, and I certainly want to avoid cognitive decline. So I really appreciate you helping me out, and we look forward to having you back on the program again soon.
Thank you so much. It's always a pleasure chatting with you, and I commend you for taking the step and making sure that you're staying on top of it and monitoring your hearing, because it's really important.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And your subscription supports all of this great BRN content. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.